Well, Dr. Robert Hancock is the president of the Texas College of Emergency Physicians, and he's joining us live now on the BBC. So thank you very much indeed for your time. Can you help us understand the pressure that's currently being exerted on healthcare in Texas?
Yes, as we've seen hospitalizations dramatically increase over the last couple of weeks, it first started putting strain on the more rural hospitals where they had limited capacity to begin with. As those got overwhelmed, the old way of handling it would be to transfer those patients out once they were over capacity to ICUs in bigger cities. The bigger cities are filling up, so there's nobody to accept those patients anymore. So we're having critically ill patients staying in emergency departments that really would be better served in ICUs. Lubbock and El Paso are probably the worst of the big cities right now for sure, but we're seeing the same trend start throughout the state, and it is starting in the more rural areas, and now we're starting to see it in the more metropolitan areas where there's nowhere to put these patients. There's no ICU beds. They wind up in the ER for many hours, if not days, in many instances, which puts a lot of stress on the emergency physicians and the nurses.
And are you satisfied with the public health messaging in Texas and the various restrictions that are in place to try and control the virus?
Well, it's so much of this comes down to personal responsibility of the people to follow any of these mandates. And I feel like we've reached a point where there's a lot of fatigue by people and complacency, where even if you have some restrictions in place, getting people to follow them have been difficult. We did see an unfortunate trend during the previous lockdown where a lot of people had other significant diseases and medical issues, but then would not get treated because of the lockdown or couldn't get to their physician. So what we found during the last lockdown, there's ups and down sides to this. And we don't want, we obviously don't want people to be harmed from other conditions. But I do feel like we will need additional restrictions and some changes as this goes forward. I'm afraid we're just starting.
And to what degree is your treatment of COVID patients preventing you and your colleagues treating patients with other medical issues?
Well, that's inevitable when you have no ICU beds available and you've got emergency physicians who are very well trained to manage critically ill patients for the first 3 or 4 hours of their presentation, are now managing some of these people for days, which is better managed by a pulmonary critical care doctor or an ICU doctor. And so what happens is that ties up a lot of our resources. That's a lot of work on our part, and it ties up our nurses, where you normally have a nurse in the ICU has 2 patients typically in the ER. Some of the nurses are having to manage 7, 8 of these critically ill patients because there's nowhere else to put them. And inevitably that trickles down to the other patients who are having heart attacks, strokes, other conditions. There's just no available bed space. There's no capacity.
Dr. Hancock, thank you very much for speaking to us. Perhaps we can check in with you again in a few days' time.
Thank you, sir.